Hello everyone. Today in series of DocPlex's KOL interviews, we have with us Dr. Fatma Almarashi, who is currently the Medical Director and Consultant at the Advanced Center for Endocrinology, Diabetes and Metabolism. She is the first UAE physician to earn American Double Board certification. Pioneering in making diabetes a public health concern in UAE, she founded and chaired UAE National Control Committee in Ministry of Health. Thank you so much, Dr. Almarashi, for this interview.
Yes, Samia, thank you.
Let me go ahead and ask you some of the questions that our viewers would love to learn from you on. In your vast experience, could you please elaborate a little bit about the metabolic syndrome?
Yeah. I call metabolic syndrome the tsunami of the 21st century. It's so prevalent and it's so common and it's unnoticed, not known by the people, general people. So it is a cluster of metabolic problems. Mainly starts with the insulin resistance being the center focus, and then accompanied by high blood pressure, impaired glucose, certain type of obesity, mainly the abdomen central obesity, lipid profile abnormality. You have dyslipidemia, the triglyceride is high, and the HDL is low. And you have uric acid is high, is not included, but lately it has been included in this package. So there is a definition for that. These are the criteria. You have to have 3 out of 5. But they have been changing based on the demographic of the people is changing. Now, for example, if you take the East Asian, the BMI of 23 is considered as high, and you need to screen these people for diabetes. While the European and the US, the BMI of 25 and above. The waist measurement also is changed because the American waist is bigger and the Eastern people's waist is smaller. So there's a criteria you fulfill based on where you stay. You take those, and if you have 3 out of 5, so it's a metabolic syndrome. There are some physical stigmata associated with it, like you have this darkening of the skin and the skin folds, mainly in the neck area. And then if you look at the elbows here, they have darkening of the skin, and that's because of the high insulin, which insulin can act like a growth hormone. Through acting through those receptor, IGF-1 receptors, they make the skin grow. And these enfolds, when there are several layers of the skin, so it shows it's dark and velvety. So I see people walking with the neck dark up to their face, and they're not aware what's going on. And the parents have kids like that, they're walking around. They're not doing anything about it. So these are the clinical examination findings that are associated or linked to the metabolic syndrome. And the risk of metabolic syndrome, the end point, we have vascular disease. Okay, atherosclerotic vascular disease. So that's why it's very important to know this, to address it, and treat every element, because we're trying to treat to prevent the heart problem. So treat the weight, try to improve the metabolism, correct the blood pressure if the blood pressure is high, lipid profile to be corrected. There's a lot of lifestyle changes that goes into this management of this condition. So it's the bad lifestyle that we are leading is leading to this increase the prevalence of the metabolic syndrome. There's a genetic background, definitely. There are factors, genetic factors that could be in the insulin receptor, the insulin itself, and beside there's other multifactorial, other genes play a role not involved in the insulin. Obesity gene is another factor if you're having obesity in the family, and beside the lifestyle. The lifestyle is the most important. We are sitting more than we're supposed to sit. 20th century, the killer was smoking. 21st century, the killer is sitting. The chair is the killer. We're spending many hours sitting on these chairs. So that's the bad lifestyle with the dinners. Sleeping late is another factor. People are staying awake in the night and then sleeping during the day. Or wake up in the morning, have to go to work, and they come in the afternoon, people sleep then. So that's a bad lifestyle. And then eating the fast food, eating a lot of fast food. Fast food are known not to be good, most of them not to be good. First, the way they prepare them, the components of the fast food itself. So, and then the ingredients, the preservative and conservative they put in it to keep that. For example, the burger, they will not make it right away. They bring a frozen meat and they put it in the thing and make the burger. So these are the things that we are dealing with, very bad lifestyle and causing this problem to rise.
And doctor, in your expert opinion, how much is the general public typically aware of metabolic syndrome?
I say now a little bit more than a couple of years back when we started this committee, and it was starting 1999. At that time, the health professionals themselves, they didn't know. The knowledge of the health professional was very minimal at that time. And with all these meetings, with all this awareness campaign in the media on the different occasions, the awareness is more now. In spite of that, having said that, in spite of that, I'm getting surprised that sometimes people come here with already diagnosed with diabetes and they have the disease for the past 10, 15 years and they don't know much about that. They don't know much about metabolic syndrome, which is one of the elements in the diabetes. We're talking about type 2, not the type 1. So it's the awareness is there better than before, but not meeting the need and demand which is there that people need with the gravity of the disease, with the prevalence of the disease is not meeting with that level. So the awareness should be more than this.
And if you could please elaborate on the advanced management strategies for metabolic syndrome.
Of course, we have to take all the causes. First, we have to make the diagnosis, both clinical and paraclinical laboratory test. We check some tests. One of them is the insulin sensitivity test. And then if those obese patients who are willing, we do the obesity gene. And we do the in-body composition analysis. We analyze the body. We say what is the basal metabolic rate, what is the percentage of fat in the body, how much is the lean mass, what is the fat mass, and how much water. So based on that, then you start approaching the patient. If the patient has obesity, obesity will be the main factor that you have to address. So every obese patient needs a lifestyle changes. So the lifestyle changes, you ask them, we have a cartoon here. Going through that cartoon, there are hormonal causes that can cause obesity. We test them. If there's no hormonal causes, they're the lifestyle things. So we educate them on those. There are some factors are modifiable. So the modifiable, they can change them. Non-modifiable, for example, if I have a gene of obesity, I cannot change my genes. But I can adopt a healthier lifestyle versus other because I know I have an obesity gene. I cannot survive if I continue to live to lead the life that I'm leading now. So we do these things, and then we also do a diet. There's a DNA diet. This is a very nice diet. It's a test where they give them a small cotton swab. They put in their mouth, they munch on it. In 5 minutes, we take that one, send it to the laboratory. Takes about 5 weeks, we get the result. It analyzes all the genes involved in the metabolism, in the fat, in the carbohydrate, in the lipid, and it also tells you what are the obesity genes that you have. And based on that, it summarizes the diet that the person should go on and then the exercise. So it tells you, for example, you have a problem in the fat metabolism, so you need to have a low-fat diet. Or your diet should be low carbohydrate. Or then the exercise, you need to moderate intensity, high intensity exercises. And it gives you example of all the exercises. So the patient is not doing haphazardly, goes to every dietitian, says the diet and go on. No. Diet is difficult to tell the person go on diet because that's part of our lifestyle, part of our living, enjoying food. But I'm doing the wrong things. I need to correct what wrong I'm doing. So that's the person need to know that. And if they do that, then it's more successful. then give him a piece of paper and telling them go to that. The person is sleeping late, okay? You just don't tell him go and don't eat and this. The problem is the sleeping. Sleeping late makes you gain weight because we have a biological clock in the brain. And this biological clock is set up in such a way to clean the house, like you're cleaning your house, to clean the body. They are involved in the body's metabolism. If I sleep late, I change that biological clock and my metabolism gets disturbed. So I have to ask that person, do that, sleep early. That person is very sedentary. He's not moving. So we need to ask him to get out of the chair, try to walk slowly. At least walk slowly. If he's not doing the DNA diet, you cannot tell him how much, but at least he needs to make some activity, to move out, to walk. There are different exercises, you can burn more, you can burn less. You don't need to go to gymnastic. If you are in the house, there's a park near your house, you have a small yard in your house, you have stairs in your house, you can use them, all those as tools to be active. You need to have the motivation. Once you have that, you start doing that, things will start falling in place. And we are not asking for major changes because we have studies done in these people who already have the impaired glucose tolerance. That means the sugar started going high in this group of metabolic syndrome. And the weight loss of about 5 to 10% prevented them from having diabetes by 58%, the lifestyle. And this lifestyle that was included in this study, it was one of the largest study done, and they were able to prevent 58% of patients from getting diabetes. So how much exercise they had to do? 150 minutes per week. And then the diet, in that study, it was very low calorie diet. So there are studies out, and there are other factors, so we need to put all into pictures. One size does not fit all. So every person has his own diet, has his own instruction, has his own. Some people, their main food is just carbohydrate. The whole day they will eat carbohydrates. So those people, very difficult to ask them, to tell them, you need to eat this. No, you have to give them alternatives. In medicine, there's always alternative in the food. I take your carbohydrate, what should I give in place? So all these instructions, and if they needed help of dietitian, we need to send them to dietitian also to get some help, because those are more into their knowledge of the food group and the quality and the quantity that the person will need. What I do, I send them to the dietitian. I tell them, for this patient, I need this amount of carbohydrate for breakfast, and this amount for lunch, and this amount for dinner, and this is for snack. So then she will give them that instruction based on that number of carbohydrates. This is the gram of carbohydrates in the morning I need. This is for lunch and this for dinner. So then she will know what to give them. Give them sample examples of menus for 3 days or 1 week. The person will become more easier to do that food. Then I just tell him, don't eat this, don't eat that, don't eat this. When you give something to the person has a knowledge, it will be easier, and they enjoy doing it, because now they know why they are doing it, what importance it has to their health, and what it is ingredient, what is their problem, so, and why they have to do it. So it makes them more fun for them to do it. Lately I found, I did not meet the company yet, but there is a company out there. People, we have the website, we give them, people log in there, and they can order their food, not cooked. They get the ingredients of the food with the recipe delivered to their house for free. And one of my patients, he said, I never enjoyed chopping onion like this time.
Yeah, it's so convenient.
He was getting the thing and he was making his food. He lost 13 kilos over 6 months.
That is very impressive.
Yeah. Another one, she lost 20 kilos. So now I'm happy that there is this side. I didn't meet these people yet. I would like to meet them. But their website is very nice. They have the different food groups. If you want vegetarian, if you want paleo diet, if you want low carb diet, it's there. So you just order it. You want 3 meals, you want 2 meals. They bring the ingredients to your house for free, and the price is very reasonable. With this day and age, with everything expensive, their price is very reasonable. So once you get that, you become motivated. You have the recipe, it's a chef recipe, and you have the ingredients. It takes you 20 minutes to get it.
That's true.
Instead of coming home, you're hungry, you go and get anything from anywhere, you just swallow, and that's why you start gaining weight, unfortunately.
That's true. Wow, that is definitely like a very, very interesting way to, you know, help patients to make sure that they cut down.
Yeah, yes.
And yet feel comfortable doing that. Now talking more about your general success rate of patient compliance for the treatment of metabolic syndrome, considering lifestyle modification in particular?
Well, that's very challenging, because wanting to make the people make changes in their lifestyle is very difficult. It's easier said than done. But I ask them some of them to use yoga if it works for them. Their work, they have to try to find a time for themselves. Some people are workaholic, they want to work all the time. Then you tell them you cannot work all the time, the body needs a rest, you need time for yourself. You'll wake up one day, you'll have all the medical problem and you cannot do anything about it. It's now you know that you are at this, so you take time to help your health and do your work at the same time. So that's the most challenging part in my specialty, to get the people to get de-stressed. Because the stress in itself releases the stress hormones. One of them is cortisol. Cortisol is catabolic hormone. Catabolic hormone means a hormone that demolishes, destroys things. So when you de-stress yourself, that hormone level is less, so your health is better. Okay? And the weight gain is less, because cortisol make you gain weight, especially in your belly area.
And last but not the least, how has the work of the Diabetes Committee in the Ministry of Health helped the general management of diabetes across UAE?
Well, the committee, I was there with them for 2 years, and then I left the Ministry of Health, so I left the committee. And the committee after that, it just went. It did not see much light. The thing is that, but what it did is just brought awareness to the policymaker there that we have this problem and it needs to be thought of, a bit to be considered, something to be done about it. So that we were able to do. And giving the importance of diabetes, there are many diabetes clinics started in this country. And even we have, that was our vision at that time, to have a big diabetes center and then have the small peripheral clinic where you can be working together under the umbrella, the small one under the umbrella of the bigger clinic, so they can refer patient to you. You take the care of them, stabilize the patient, and then return them back to them. And every now and then you educated the group that are taking care of those patients, so you are on the same page. They know what are the standards. So a little bit improvement. So it's what is compared to what was before is much better now. And there are several diabetes centers, as I mentioned, in the country. So that made diabetes become a big title. Some people, they ask me, is it a contagious disease? Really, because in the family members, this one will have, the other one will have, the other one will have. It's a very common disease in our community. And I think, beside our lifestyle and this, I think the thing we are taking in our stomach, there's some pollutions in there. And that is affecting our body's metabolism. I'll give an example. The drinking water that we drink might not be a healthy one. Nobody has looked into that, okay? Because those days when we were drinking waters from the well, we're drinking waters from the clay pots, people were healthier. So that's one of the factors. This is an environmental factor. So till these people will wake up, will accept this problem, starting being interested to take care of that, we'll still be seeing the diabetes on the rise. Besides, there was a study, very nice study in Germany before, and there's another one coming up. Living in rural area versus urban area. The risk of diabetes is higher in people who are living in urban area. That's because of the pollution. You inhale all these substances, they go into their lungs, and they give this kind of slow inflammatory process. Then releases substances, those affecting your insulin function and action. So that increases the risk of diabetes then. So we have a lot of things that have not even touched or put a finger on it to address them as the causes. People who come from other countries, they move to UAE, you ask them how long they've been, tell you 2 years, 5 years, 3 years, and they have diabetes. I tell them, welcome to UAE. I think our environment is not very healthy. We have a lot of this building construction going around, and that raises a lot of the dusty cities. So we have, this is a big problem till that is resolved, and then things will be better. Now if you go sit in those areas where it is green, it's much healthier, because our environment has become, in all these traffic, how much cars we have, the pollution is very high here. So these are the risks that we have, which we cannot change, unfortunately, much, but we can address them. One day, something will happen. This affects the fertility as well. You're seeing now the problem with these countries, we have having problem with fertility. Before, the couples will get 5, 6, 7. Now they're not even able to get one child.
Wow. Just because of the influence
of the insulin. The insulin resistance, they used to call it polycystic ovary. Now it's called ovarian metabolic syndrome.
Oh, right.
Yeah. So it's affecting every part of our health. It's a very big thing. That's why it's touched. You touched on my point, which I like. I've given a lot of lecture in metabolic syndrome.
Yeah, we did notice that, and I was actually going to ask you, is it all right if we ask you 2 more questions? Because we were very interested in, you pioneered in making diabetes a public health concern right from its start. But how was your journey across why you decided to, how you identified this is one of the reasons, one of the areas that we should be concerned about?
Because the number is rising. In UAE, our diabetes prevalence, it's 1 in 4, 1 in 5. 1.5 and 1.4 now has diabetes. And type 1 those days before, it was very rare, and now we have a lot of patients with type 1 diabetes. And type 1 diabetes, definitely you have to have the genetic backup, the HLA system, but it is these pollutions, viruses, that is bringing it up. Okay? So diabetes, it's a very bad disease. It affects every organ in the body, every part of your body, and you cannot just, it's not a sugar disease, it's a vascular disease. People think diabetes is just a sugar. No, it affects your blood pressure, it affects your lipid, and those lipids become bad, your arteries become affected. So it's very important disease. If you know diabetes, if you treat diabetes well, you have done your proper medicine. Okay.
That is truly remarkable. Thank you so much, Doctor.
Yeah. You're welcome.